Welcome to Mind Matters podcast, where we dive deep into the stories and experiences of those who make a difference in the world of healthcare. Today, we're thrilled to introduce you to Selina Stell, a compassionate and dedicated certified nursing assistant with 3 years of specialized experience in dementia care. Selina's journey into caregiving began at a very young age, inspired by her mother, who would often take her along to work. This early exposure ignited a lifelong passion in Selina, driving her to provide empathetic, patient-centered care for those living with dementia. Known for her expert care and ability to connect with patients on a deeply personal level, Selina brings a wealth of knowledge and heart to her role at a memory care community. In today's episode, we'll explore Selina's approach to dementia care, discussing how she addresses the emotional and physical needs of her patients, the importance of maintaining a consistent routine, and her strategies for effective communication with those who struggle with verbal expression. We'll also dive into the challenges of self-care for CNAs and Selina's advice for preventing burnout. Plus, we'll get a glimpse into her future goals and what she hopes to achieve beyond her current role. So, whether you're a fellow caregiver, a family member of someone with dementia, or simply interested in learning more about this vital field, stay tuned for an insightful and inspiring conversation with Selina Stell. Hi, Selina.
Hi,
How are you today?
I'm well. How are you?
I'm good. Thank you so much for being here today and for being a part of Mind Matters, our conversation of dementia segment. And I really wanted to have this opportunity to interview with you because I've worked with you now for 3 or so years, and I just see your work ethic and I see how good you are and how passionate you are. But for our audience today, can you share a little bit about who you are, how you got into the caregiving industry, and why you're so passionate about it?
Yes. Well, I have been a caregiver for about 3 years before I decided to pursue and to get my CNA. I got my passion from my mother. She was a CNA for a long time. She would take me to work with her, and mainly she worked with dementia patients, but she worked with all, and I kind of just got a passion to be with dementia. So
Yeah.
it made me want to help others and care for the elderly people.
Oh, wow. How old were you when you started working with your mom?
I was like 10.
Okay.
Yes.
You're a little
So,
younger than I was. I started with my mom when I was 15,
oh, yeah.
doing caregiving, helping
Yes.
people in their homes. So, was this a private caregiving capacity?
She worked at different facilities.
Okay.
On like Bring Your Child to Work Day, I would go with her. So, or some days on the weekend, they will allow like the kids to come up there and kind of interact and do activities with the residents. So
Okay.
it was pretty nice.
So, so your mom obviously planted that seed. So, in that seed, and as it started to grow, what made you really say, I'm passionate about this and I want to work with the elderly and with dementia patients in particular?
Um, I wasn't the best, uh, making the best decisions in my life.
Okay.
So I had a terrible car accident. So after that, I was like, you know what? I need to go and do something with myself and be better. My grandfather passed away, and I wasn't as close with him. And he wasn't in a facility or nothing like that, but he was really old. And I wanted to be able to care for him. And also, like, my auntie was very sick and before she passed away, so I wanted to pursue and to caring for others and give
Oh,
back. So,
wow. So it started with the care and love of your grandfather,
yes.
and then just going through that process with him.
Yes.
Were you with him when he passed?
Yes.
Okay.
Yes. It was unexpectedly, but yes.
But that's such a beautiful moment in time that people don't realize.
Yes. It really is.
Wow. Well, I'm so excited to do this interview
I
with
am
you.
too. Thank you for having
Of
me.
course.
So, how I know you is for you being a CNA and
Yes.
being a caregiver for, um, we call them residents
Yes.
in communities. Some people would call them patients,
Yes.
but they are people that do have some form of dementia.
Yes.
And you just have a very special way with them.
Yeah.
But one of the things about dementia, there's something called sundowning in the evenings. We
Yes.
kind of call that a very interesting time.
Yes.
And so it's pretty emotional and it's an impact that's pretty significant on families and on caregivers. So, not just CNAs in communities, but also caregivers in the home, and those caregivers could be family members as well. But in a community such as the one that you work in, it can be pretty taxing and emotional and psychological on the residents and on caregivers. So, how would you recognize when residents are having some sort of emotional breakdown, and how do you recognize it, and how do you help them through that?
A lot of the times when I'm working with my dementia patients, a lot of the times I can see them getting frustrated or overwhelmed or pouting or just kind of being combative. Um, you have to just be patient. You
Mm-hmm.
have to be patient. You have to give them a second. You have to, because humans, we get irritated.
That's
We
right.
we get annoyed.
Yep.
They get overwhelmed, especially if it's a lot of people in their homes that they're not familiar with. So I kind of just give them time
Mm-hmm.
and reapproach. It's really about the reapproach is really, really important. You can't treat them like babies because they're not
They're not.
babies. You can't talk to them like babies. Respect your elders. So you want to go to them and go down to their level rather than sitting and making sure you're eye to eye with them, holding their hand, rubbing them, seeing how their day was doing.
Wow.
That's really important. So
So I would even say that's a form of a communication technique that you use with people as they're kind of getting irritated and
yes.
agitated. So in such scenarios, could you share a little example of how someone might be irritated? You kind of did that already, but I just want to showcase the love and care that you have with in that kind of nonverbal communication with residents. So how do you take care of them in that regard?
Sometimes if they're swinging
Mm-hmm.
and
Like
fighting,
hitting?
yes,
Mm-hmm.
swinging back to hit you, you kind of just ask them like, "What's the matter? What's wrong?" Kind of take their hand, rub it.
Yeah.
If they're still being combative, you have to step away. You have to give them a minute. If someone is frustrated and just like overwhelmed,
Mm-hmm.
pouting, their anxiety is bad, you kind of want to walk with them, take some laps, talk with them,
Yeah.
try to distract their mind from whatever just happened. A lot of times after they get out the shower, they're kind of like,
Tell me about
oh,
showers.
showers is challenging for dementia patients. They will always say no.
Mm-hmm.
So you have to kind of, they have rights, but you can't ask them like, "Hey, do you want to take a shower?" They'll say no.
No, I've
I
already
just took
done
one.
that.
Yeah. They'll say no. I took one this morning, and
Yeah.
really they didn't, but in their mind they did. So you kind of have to say like, "Hey, let's go take a shower. Let's go get clean." Sometimes you have to tell a little story and say, "Oh, your wife is coming. Your
Yeah.
husband is coming. Someone's important is coming to see you. Let me get you ready and get you dressed." And a lot of times that'll get them in there. Now sometimes that doesn't work.
Yeah.
So you have to,
Use different techniques with
yes,
that.
you have to, and getting them in there sometimes is a challenge, but afterwards they feel so much better.
Yeah.
They're really happy. They say thank you. They're comfortable. They're clean. A shower makes everybody feel
It
refreshed. So,
for sure.
yes.
Yeah, I mean, I remember using techniques like maybe sitting them on the toilet, then
Yes.
undressing them,
Yes.
and then sometimes you can only wash up parts at a time.
Yes. It's challenging sometimes, but I can get it done
Yeah.
definitely. So.
So, but you're up for the challenge.
Yes, yes. I'm pretty well if I have to step inside the shower with them, I mean, sometimes they done threw water on me, but I'm okay with it. I'm like,
Yeah.
it doesn't hurt. So anything to make them feel
It's
comfortable and be
water, it'll
happy.
dry.
Yes.
So, in dementia care, it is very important to have some form of routine.
Yes.
Routine is pretty important, and scheduled routines are important to help minimize some of that, what they call behaviors or
Yes.
behavioral expressions,
Yes.
which is just a form of communication.
Yes.
So, what is your approach in routine, and how do you feel about routines?
A routine is important. It's not only important for you, it's important for the residents as well. A routine is just, it keeps you on track with things. Now, sometimes that routine might get messed up, but with dementia patients, if they're out of routine, it's kind of like a bad day sometimes.
Yeah.
It's out of their normal, but it's also really good for them mentally, physically. That way they don't get overwhelmed and frustrated and their anxiety, because if they're looking forward to something at 2 o'clock every day, they're looking for it. And if it's not
Yes.
there, they're panicking like, what happened? Why isn't it? So a routine is really good. Even just with getting up in the morning, getting them dressed, getting them ready for breakfast, a routine is very important.
Yeah, for sure.
Yes.
And then I imagine if they don't have that routine in place, then you start to see some agitation
Yes.
again.
Yes.
Yeah.
They will get frustrated, overwhelmed. A routine is just really important to have. Now, some days it don't go that way, but
Yeah.
try to stay on track with them.
Well, you said something really important about just the humanity, and we're human. We have bad
Yes.
days sometimes.
Yes.
And whether you have dementia or not, sometimes days can be a little tough.
Yes.
Doing this kind of work day in and day out, helping people, always being happy for them, always approaching them in a very neutral, positive manner, it can weigh on you as the caregiver sometimes. So there is a such thing as caregiver burnout.
Yes.
Do you ever experience that? And if you do, how do you approach that? Or what would your advice be for other caregivers or CNAs to help them prevent being burned out?
Being in the nursing field, you can get burnt out pretty quickly. It's a lot of work. Your heart has to be in it, and you have to be really for it. If you're working over 40 hours, it can become overwhelming for yourself, but you have to take time for yourself
Yeah.
in order to give the residents 100%. If you're not 100%, you're not giving them 100%. So you have to make sure you're mentally and physically okay within yourself and ready to go before you can care for others.
Yeah.
And it's not you necessarily being selfish. You just have to take care of yourself
Yeah.
first, and then you can take care of others.
Well, like you said, if you're not 100%, um, residents that have dementia actually can sense that.
Yes.
And if you're off and your aura is not good,
Yes. Oh, they definitely know when you're frustrated or
yeah.
you're not being patient, and they definitely know, and it will make them go even slower. So,
And then you have to be even more patient.
yes, yes. So patience is priority. Patience is priority, especially working with dementia patients.
Yeah. Do you have a favorite part of working with patients with dementia?
Yes, I love the connection I have with them.
Yeah.
Dealing with the same residents every day, and they recognize me, it makes me feel so great.
Yeah.
Loving on them, coloring with them, being there when they're emotional or when they're scared, just
Yeah.
holding their hands. I enjoy putting them down for bed, making sure they're comfortable, tucking them in, kissing them, telling them I love them. Like, they really need that. Not a lot of families can make it in every day.
That's
So it's
right.
like I'm their family, and I really enjoy it. I'm not really close with my grandmother, so I look at them as
Oh,
my grandmother and father. So
I
I
know
really enjoy it.
I know one resident in particular that actually calls you granddaughter.
Yes.
It's so cute.
Yes. She remembers me, and if someone else wants to come and care for her, she's like, go get my granddaughter.
And how do family members feel about the love and attention that you give to their family?
They love it. they know that I treat them as if they were family.
Yeah.
I have favorites, but I treat them all the same. I love on them. I just really care for them. The families
Yeah.
love me. They appreciate what I do for them. They see that I'm a hard worker, and I'm very appreciative to have them. They definitely give me my praise when it's due.
Yeah, truly,
Yes.
truly. Well, I just see the light in you. I just see how families can really love having you around. Your spirit is just so beautiful.
Thank you.
And the residents, they're just so fortunate to have you in the position. Um, there are some that maybe don't have a Selena out there in the world. But with that being said, what goals do you have in the future? Are you going to stay in the healthcare field, or what's your aspiration?
I would love to become an RN and then
Okay.
eventually get my BSN and then eventually own my own facility.
Okay.
I think I would be great. I would have different units, dementia, skilled, long term, everything. I still want to care for people. Even if I become an RN, I know it's not a lot that get out there on the floor, but
Yeah.
I don't mind getting out on the floor, helping to care for them. It's my passion to care for them.
I,
And they need someone like me.
I love that. I can see you going all the way. We have big hopes and dreams for you.
Thank you. Thank you.
Well, this has been really good. But before we end our segment, do you have any advice for our audience or other CNAs out there that they can take into the world and become that stable person, that Selena, that special person to someone else out in the medical field?
Yes. You have to be in it and your heart has to be there. You cannot just go in and look at it as a job. It is a career. You're caring for another life. You're caring for another patient. So you have to be in it, and your heart has to be there. And be patient with them. Love on them as if they were your own grandparents. Treat them the way you would want to be treated, and you'll make it far in life. And always be a helping hand.
That's excellent advice, Selena.
Thank you.
Thank you so much. So I'm Chastity Robinson Mwangi, and this is Selina Stell. We thank you for watching. If you like this episode, please make sure you subscribe, like, and share, and let someone else know this great information is out there. Thank you so much. I see eyeballs.
Right, and eyebrows going up and down. We're going to be making a lot of eye contact, and that is weird.
Oh, you think so?
Yes, yes.